Hello, PsychU community, and welcome to today's webinar, Stigma in Mental Health and Substance Use Disorder. Thank you for joining us. My name is Jason Carter. I'm a Senior Medical Science Liaison for Otsuka Pharmaceutical Development and Commercialization, Inc. I will serve as the moderator for today's discussion featuring Dr. Stephen Loyd, Micheal Measom, and Wesley Geminn. This presentation is sponsored by Otsuka and Lundbeck. So today's webinar is going to be a panel discussion today. We wanted to make it as conversational as we could for the audience. I appreciate our audience joining us today. So gentlemen, as we get started and we look at just how vast an issue mental illness and substance use disorder is, if we look at the 2019 National Survey on Drug Use and Health in adults 18 and over, it's estimated that 9.7 million adults had a substance use disorder with no mental illness. Over 42 million had a mental illness without a substance use disorder, and about 9.5 million had both. So I'm just curious what your all's thoughts are about that. And also, just do we see differences in what we see based on our geography? I know, Dr. Measom, you are many, many miles away from the three of us here in Tennessee, but just curious, what is your experience? What does your practice look like? What does your geography look like? And maybe we can compare and contrast that a little bit to what we see here in the South in Tennessee.
So, I would say living in Salt Lake City, Utah, it's kind of an interesting place to live. In the United States, we are number 2 in prescription drug abuse, and we're number 1 in per capita consumption of antidepressants and Jello, by the way. But, it's a unique place. Every place has its own culture. I was struck by what you said because I've always loved to take care of people that have both mental illness and substance use disorders. And when I was training in South Carolina, it was a very divided system, and I always wanted to see the ones that they referred to each other. So I love dealing with people that have both day in and day out.
So, Dr. Geminn, what are your thoughts?
Well, one of the concerning things about that number is the ability to access our treatment providers. We know prevalence is going up. It's only made worse by the COVID pandemic, but we haven't really increased the number of providers. We often at the department get very valid letters of concern, letters that are directed to the governor that are routed to us, of individuals needing help. And unfortunately, we're kind of in a position now where we still have wait lists. We still have rural communities that lack access to treatment. And so when it comes to sort of a resource planning, it only makes it more challenging, but will hopefully bring more opportunities.
Any thoughts, Dr. Loyd?
Yeah, Jason, thank you, and I appreciate Dr. Measom and Dr. Giminn's comments. I notice a difference even within Tennessee. I work the majority of the time in Middle Tennessee in the greater Nashville area, and then when I get off with you guys today, I'll be headed east to rural Cox County, Tennessee. It's one of the poorest counties in the state, and the difference in working in greater Nashville, Metro Nashville, and Cox County is got to be like Earth versus Pluto. It's just amazing, and I think what Wes said is spot on. It's resources in the rural area. Stigma is what it is. It's the biggest preventer of people seeking care that I know of. It's not lack of resources, it's actually stigma. But then whenever we do get people into treatment, just in the rural areas of having the providers that we need. And Dr. Measom, you talk about those patients that crossed over, and sometimes I get to the point where I hate the term co-occurring because that's all I see. And I know that it's the population that I have, but just getting the mental health services that we need for the folks, because I treat mainly substance use disorder, is very challenging, Jason. And it's challenging it's even more challenging depending on the geographical location within the state of Tennessee. And I know Wes already knows that. You get folks in rural areas, it's very, very tough from a mental health standpoint, as well as the substance use standpoint.
So I know several years ago, the Department of Mental Health had done some surveys looking at psychiatry specialists, and I remember that they were very concentrated, towards the metropolitan areas, that there were very little access once you got into the rural areas. Dr. Measom, you mentioned something about treating both, and so did you, Dr. Loyd. I remember when I was with the department, we had separate licensure. So you were licensed as a mental health treatment provider, you were licensed as a substance abuse treatment provider, and that within itself almost seems like it created some silos, because some had one license, some had the other, very few had both. Is it that way in Utah as well? Do you still see these kind of silos? One person treats mental health, they don't address the substance use issues, or vice versa?
No, it's not really siloed that way. The problem is the bias against people that have a substance use disorder. In fact, a dear friend of mine called me because he wants to set up a referral system, and he said, "Oh, we don't treat substance use." And I just thought, boy, you're really missing out on helping people and really missing out on a rewarding career.
Yeah. So was that a mental health provider, or was that a primary care provider? Who was that?
Psychiatrist.
Psychiatrist. Yeah. I see Dr. Loyd nodding his head. Do you see the same as well? And Wes smiling. So
I do, Dr. Meesa. I'm so glad to hear you say that, because we get it's an honor to get to treat people with substance use disorder and co-occurring mental health disorders, because I'm an internist by trade, and I don't mean this the wrong way, Jason, and I'm not knocking the profession of internal medicine. But when I was a hospitalist and working in the ICU, I felt like really all I did was document the decline of the human condition. I was a really good documenter, and I'm not saying people didn't get better, but it's treating severe chronic disease, and it's depressing sometimes. I get a front row seat to watching people's lives change, and just like Dr. Measom said, that's why I was smiling, because I don't hear that said very often. It's an honor, and it's fun. So when I hear people that, say we don't treat this or we don't treat that within substance abuse or mental health, I'm thinking, man, you're missing an opportunity, because it is so much fun to watch somebody's life change over the course of sometimes even just a few days or weeks, those initial improvements when they finally get access to care. So that's what was making me smile. I was glad to hear somebody else say it.
Well, and I used to, when I did academics and had residents, I used to pass out an article called "What to Do When You Hate Your Alcoholic Patient," and we'd have a discussion about this, right? So it's so interesting, because when I go into a primary care office, I hear this all the time, like, I don't want to treat alcohol. And, I just say, it's pretty simple. Somebody has an alcohol problem, the easiest thing to do is just to talk about it. And it's just interesting, the bias that they have against somebody who has an addiction. And I just talked to them about, just imagine it's diabetes, and you're talking about behavioral changes, medications, what can we do to help you? Just the same approach as if somebody has an elevated hemoglobin A1C.
That kind of leads us into the next point that we were talking about. When we talk about stigma, you really have multi-levels of stigma, from the patient to other healthcare providers to the system. So does anybody have any thoughts from and even within mental health and substance use disorder? I think you kind of alluded to this. I think I've heard some people refer to, well, mental illness is a disease, but substance use disorder really isn't a disease. I don't know if you all have heard people kind of say that but before or not, that they've kind of got a different opinion of that. So when we talk about stigma, in mental illness, especially substance use disorder, from a patient perspective, just curious what your all's thoughts were.
I think, again, Jason, just because of where I practice, there's a difference in Middle Tennessee and rural East Tennessee when it comes to this, because I think mental illness is still stigmatized a lot, not looked at as a disease. And of course we run into the thought that, well, how can something be a disease when you're choosing to do it, which is how addiction is looked at. And then whenever you're talking about using medication to treat particularly substance use disorder of any type, the old "you're switching one drug for another" argument. And then with regards to mental illness, well, if you pulled yourself up by your own bootstraps and, let the past be the past, you would be fine. And so that's a really prevalent view of mental illness in rural East Tennessee. Now, when I get down into Middle Tennessee and, Greater Nashville, which is where I am right now, not so much, although a little bit, but not so much. So again, it's depending on the areas of the state. Really see hey, this is not a disease when you're talking about substance use disorder. Matter of fact, we're working on a jail program up in the other end of the state in East Tennessee, and the big challenge is working with jail staff whenever we talk about what we're doing, because the prevailing thought is that, oh gosh, you guys are coming here wanting to do this. These people just need to stop. They need to quit. They need to put it down. They're choosing to do it, and there's really no other explanation. So it's a tough road to hoe a lot of times.
Oh, it's a big city problem as well. It's a big city problem in Salt Lake City. I can't tell you how many times I've spoken to prominent community leaders and had the very same discussion.